Awesome.
Hey, everybody. Welcome back to the Func Med Nation podcast. I have the pleasure of being here today with James Maskell, who, to be honest, has done so many things over the last few years. It would probably take 10 minutes just to talk through them all. James, welcome. I'm really glad you're here.
Func Med Nation. I'm all about it. I'm glad to be here with the whole nation. So great. Thanks for having me.
Yeah, it's a pleasure. So there's so many different ways that this conversation can go. And I know you and I had agreed that, we were going to do this more as an organic conversation rather than just a whole bunch of pre-planned questions. One of the first things that I want to ask you about is, and this is really just coming from my own experience and in my own observation, but I know that you wrote your first book, The Evolution of Medicine, back in 2016-ish, somewhere around there, I think it was. And, at that time I was doing a Func Med practice in North Tampa, like the Wesley Chapel area. And there was a guy that I was renting space from, and he asked me one day if I had heard of you and Evolution of Medicine. And I hadn't. And, I started paying attention, and it kind of seemed to me, like I said to you right before we started recording, it seemed to me like, and maybe it's just my experience, but like you weren't on anybody's radar. And then all of a sudden, bam, you were on everybody's radar. So how did all of that happen? Like, how did you, and maybe, again, this is just my observation, maybe you were there and I just didn't know about you or the work that you were doing.
Well, look, they say, every overnight success is 10 years in the making, right? So it was actually about 10 years exactly. So first of all, I grew up in a household where natural health was the way. And I didn't really realize that was weird until I went to school and realized no one else saw a chiropractor, no one else took homeopathy, no one else ate vegetables, right? And, that was just sort of a rude awakening, moving from where I'd grown up with in sort of more of a commune kind of a vibe to going to school and realizing my norms were not other norms, right? So that was sort of my early days. Then I sort of rejected my weird family and, as everyone does, and did economics. And I thought I need to be an investment banker. And during my economics training, I did health economics. And that's when I realized holy shit, we're about to go off a cliff. And that cliff is built on chronic illness, right? Chronic illness is driving such a increase in costs, whether that be in the UK where I was at school or the US where I was born, that in my lifetime, and not when I'm 80, when I'm 50, which is now only 8 years away, we were just basically going to completely run out of money because so much of our money was going to be spent on chronic illness. And I also recognized that the paradigm of care that everyone else was doing had no real shot at reversing chronic illness, right? You take one drug and then you're on 3 drugs and then you're on 5 drugs and the individual cost of care goes up. And if you multiply that by 300 million, that's how you get those numbers. And I knew that chronic disease was driving it. And I just knew, I had maintained relationships with those kind of doctors. I was just aware that there was a different way of doing healthcare. So in 2005, and this was a psychedelic assisted decision in retrospect, I would say, I decided that I was going to move to America, take advantage of my American passport, which I had because I was born in Colorado. And I was going to leave my investment banking job, take a 90% pay cut and try and understand if, the first thing is chronic disease reversible and under what circumstances is it? And that was the beginning of the journey. So that was 2005. The book came out in 2016. And in between all of that was, first of all, me seeking to understand, right, what's really going on. And then, from about 2011, 12 onwards was now, starting to share my own ideas of what was possible.
So what was in the gap between 2005 and 2016? I mean, you said that you were learning. I mean, what did that look like? Were you focusing more on the economic side and understanding, insurance and pay as you go versus, cash, or were you starting to delve into listening to functional medicine experts and learning more about the clinical side? Because, I go to, for example, I go to your YouTube channel and I listen to some of the interviews that you do. And it's quite clear that you have come to some level of understanding of some of the pathophysiology of the chronic diseases and the metabolic pathways that we're all trying to manipulate as we interact with patients and give them our protocols, whether that's diet changes or supplementation or whatever the case might be. So what was in that roughly 10-year period between when you made that commitment and when you came out with the book, and all of a sudden there was this new thing that we could latch onto and start building community around?
Yeah. So first things first, I went to work in a practice. So I moved to Georgia, and I started working in a clinic that my cousin had started. And he had worked previously in the spa industry, but was convinced that the future of medicine was going to be like this kind of care delivered in a spa environment. And I started working at this business. And that was, so a couple of things happened there. One is I saw chronic disease being reversed, right, by the practitioner there. So I saw people that in 3, 6, 9, 12 months went from like very chronically ill to actually like physically transformed in front of me. So I was bearing witness to chronic disease reversal, which was interesting. And secondly, you know, that clinic was extremely well run, right? This was a clinic that had a operations manual 9 inches thick. Every process was documented. Right. And I mean, I just thought that's the way the clinics ran. And so I was just like, oh, this is how you run a clinic. And it was doing well. And I was witnessing it. So that was
I'm laughing. I'm laughing because we know how clinics should run, but that's not how most clinics are run.
No, yeah. So it was a great learning period. So then in 2007, so now 18 months in, I wanted to see, like, is this a one-off? Like, I was in the hills of rural Georgia, right? So I had an inkling that there were other clinics that were doing this, but I didn't really know. So I took a job where I could find out, and I was a supplement sales rep, right? And I was selling to doctors in a wide range, right? So on one end, you had like people doing energy medicine in their garage, right? Who'd had a weekend certificate in something, right through to, you know, highly trained physicians who, you know, had gone under care themselves because they had an issue they couldn't work out, had reversed their own chronic condition, and were like, what was that? And how do I do it? Right. And everything in between, chiropractors, acupuncturists, naturopathic doctors, and everything. And that was my learning. Like, and I would say to anyone, if you want to learn about this industry, the quickest way to do it is to sell to that industry. Because what I did, if I was meeting you, if you were my customer in those days, I would hang out. And the first thing that I would do is basically ask you all about your practice. What do you specialize in? What do you get the best results in? How do you do it? And basically for the next 4 years, that's all I did. I put 100,000 miles on my car. My territory was Virginia to Maine, and I met every kind of weird and wonderful doctor. Now, the thing that I was selling was more focused on, I would say, even further left than functional medicine at that point. It was like bioenergetic medicine. So I was working with a lot of people who were doing like muscle testing and, you know, and sort of like homotoxicology and spagyric herbs. And so a couple of things are happening. One, I'm learning about all the different types of practitioners. I'm learning really rapidly because I'm making 40 outbound phone calls a day. I'm meeting with 2 doctors a day, and I'm building my business. But I'm also going to these conferences that the company's putting on. I'm actually putting on these conferences. So I'm calling all the doctors, getting these events going on. And that's where I'm starting to learn about physiology, how different diseases are manifested, what are the different protocols, what can you do to reverse these issues, you know, how all these different practitioners deal with like being part lifestyle medicine, right? You've got to get people to do the healthy behaviors, but there's also all these precision elements that can be done through lab testing or can be done through muscle testing or whatever. So this is like basically like a 4-year, you know, training in understanding everything to do with the industry. So that's the first part.
Yeah. You know, that's interesting. What I'm hearing from that is that, and this is probably fairly unique, is that you have a solid grasp of both the macroscopic and the microscopic aspects of functional medicine, right? You've got the background of the large scale economics and what happens with, you know, broken systems like we have in the insurance model and the road towards bankruptcy, all the way down to, as you say, the weird and the wonderful practitioners, because we're clearly not all built the same. We don't all think the same. we don't all practice the same. I would say we probably all have the same general goals and guidelines, but how many people have you met in your travels, particularly since you started EvoMed? How many people have you met that share that dual view of the big picture and the small picture?
Not that many. Look, I had to put that part of it to bed too. Like for a long time, honestly, I'm not thinking about the big picture at all. I'm just really trying to understand, what is this? What are the commonalities? Like I'm also seeing that these people don't speak the same language.
Yeah.
Right. You know, that the chiropractor and the acupuncturist are doing quite similar things, are affecting the body in similar ways, but don't talk the same language. And are actually like, there's barriers to clinics working together, to team-based care, because it's all, you know, it's all different language. And honestly, I didn't really hear about functional medicine. I mean, I heard about it, but it wasn't in 2009. So I moved to New York. I built my business up enough that I could afford to live in New York. I lived in New Haven, Connecticut for 2 years, moved to New York, and I went to the Integrative Health Symposium in New York. And that was the first time that I saw Jeff Bland lecture. I'd heard about Jeff Bland, and I went there, and I went to that conference. I got myself a ticket, and I sat in there, and I looked around, and I was like, dang, like he's got the attention of doctors, right? MDs are listening to this guy and like paying attention and are interested in what he has to say, because it was very far and few between the MDs that I would meet in my thing, like very, very few, like very few. So, you know, so I was like, oh, this is interesting. And then the next year I heard Christy Hughes speak at the same conversation, and I saw her lay out the like functional medicine matrix. And that was the first time where I thought to myself, hang on a minute, like if we're looking for a common language for doctors to like, you know, to build teams around, right, where people could work together, this has got a lot of the right pieces to it, right? You've got the Lifestyle Medicine Foundation that has to be there. Everyone would say that. You don't get, even homeopaths would say, look, you've got to do the basic, you've got to live a healthy life for homeopathy to work. You can't be eating cheeseburgers and McDonald's and expect that, you know, your arnica is going to work well. You've got to be healthy. So I realized like all of them had the health thing, but they had some sort of way of tracking like how the body was breaking down. And that's what I recognize is like, look, you don't get a chronic disease overnight. It takes a while to happen. So how do we work out? So I thought at that point, that was when I started to think, okay, functional medicine maybe is where it's at. And also because the only MDs that I could ever sell to had already had some training in functional medicine. Like you can't go from allopathy to bioenergetic medicine in one go. Unless you get chronically ill and have that save you. You typically need to learn systems biology first, right? In functional medicine.
You know, I'll tell you that what you just said really resonates with me. I've been teaching functional medicine seminars since 2008. And back in that first year or two, if I had one medical doctor in a class of, say, 50 people, that would be unusual. But you know, with the 2 years of coronavirus accepting, you know, the last couple of years prior to that in teaching, if I didn't have in a room of 50 people, if I didn't have 5 or 6 MDs, DOs, nurse practitioners, that would be unusual. And so it seemed to me that there was, you know, what I've experienced as a speaker is that there's been a significant change in the demographics of people going to functional medicine seminars. And there's a change in the sophistication of their understanding of physiology and systems biology. Because that's really, and I know that you don't probably know anything about my background because we've never met, never talked before, but you know, I've taught for 15 years-ish for Datis Karazian, Apex Energetics. I don't know if you're familiar with those names, but you know, that was the one thing that Dr. Karazian brought to the functional medicine world was, you know, let's stop looking at labs or nutritional surveys and looking at nutrient deficiencies in diet, and let's use diagnostic testing to do an analysis of a systems-based approach. And I think that once we started teaching that resonated with the medical community and the segment of people who were potentially interested in functional or integrative medicine. That kind of spoke to them. And that's radically different than the muscle testing approach, or, you know, like say in the nutritional world, the diet survey, and let's, you know, look for your diet deficiencies.
Yeah.
And so I've seen a huge change. And this is one of the reasons that I wanted to start talking to industry leaders and other clinicians, is because functional medicine, from my viewpoint, has changed so radically in the last 10 years. And I'm interested in hearing your experience with that. I mean, obviously, your organization and the things that you're doing, which now I understand is multiple branches to it, right? You've got EvoMed, you've got the Functional Forum, you've got Heal Communities, and we'll get to that point. But what kind of changes have you seen in, number one, the demographics of people that are engaging at some level with the work that you do? And what about the sophistication of, let's say, the average practitioner that again engages with your type of communities?
Yeah. So, I mean, there's no doubt, like, 10 years has gone by since that time. And there's no doubt, like, and I hope that we've played a role in it to some degree, in that there's a functional medicine doctor in every town. Yeah. Right. And people have found their way to it in many different ways. Right. So, yeah, I mean, you've seen a huge growth in interest in doctors, individual doctors seeing it as a way to sort of, leave the job that they hate and come to it. I mean, just to fill in a bit more of the gap. So, from 2011 to 2014, those years, I'm still the sales rep and the supplements. I'm still doing that. And I'm still going to conferences. Now I'm putting on bigger conferences for my territory in my area. But I'm also now, like, sort of flexing my own ideas about practice management. And, around that time is also the internet is starting to be like a real force, right? You could really do telemedicine for the first time, 2011, 12. You could really, you have electronic health records coming on. You have, different technologies emerging. And the big break that I got, honestly, was that I went at that 2010 Integrated Health Symposium. I met this guy called Eric Goldman, and he has this publication called Holistic Primary Care, which is like a newspaper for doctors interested in functional integrative medicine. He put me as a speaker in his conference. So at this point, like, I have this alter ego. Yes, I'm the sales rep, but I've created my own sort of program, essentially taking the learnings of what, as a sales rep, what I realized is that there was this huge black hole of clinical knowledge where I could never learn as much as you, and I didn't really want to. But what I recognized was that most doctors were deficient in the practice management area. And I just knew how to run the practice because I'd run that practice for a year and a half with the operations manual. So I would kind of make a deal with these doctors. I would say, look, I'll help you run your practice and get your operations and things dialed in and your hiring and your systems, but you got to use my supplements. That's how I get paid. So that was like my journey at that point. And then I started essentially a separate company where I helped doctors and did consulting for them on their practice. And in 2011, I got my first speaking gig, speaking in front of mainstream, MDs. So that conference was all MDs. So now in 2011, I'm speaking at that conference. So one is I'm now a speaker at a conference with like other big names. So that's how I start to meet the other big names, is that for the next 4 years, I speak at that conference. Because the first year that I get there, I realize, like, most other speakers are really boring. And I know enough about this crowd, and like, I just try and make it like funny and engaging and like just, making jokes that only a functional medicine doctor would get, because like it's a unique world and I just understand it really well. So, in 2011, I kind of bring the house down. I get brought back every year, and I'm building confidence now as like a practice management guy. And I'm starting to, do some things in that end. My wife starts a business making websites for doctors, because I realized that's like a big issue if you're trying to build a successful practice. The website was, pretty average. So I'm like all in and learning. And, over those years, so then 2013 comes around, and October 2013 is like a key moment. So a couple of things happen. I speak at that conference, and I meet Dr. Shilpa Saxena, and that's the first time I hear about group visits. She speaks at that one. And it was the first time where Eric Goldman gave me a camera and was like, why don't you just go and make some content around your conference? So now I'm like interviewing doctors and just saying, hey, would you do a quick interview for the camera? And I realized at that point, like, I love interviewing people and it's really fun and I want to do more of it. And around that same time, I go to the New York Naturopathic Conference and I see something there, which is that they have these long talks, which they always have, hour lectures, but they gave people these 15-minute lectures in between. And I realized, like, if you only give people 15 minutes, they give all their best stuff in 15 minutes. And actually an hour, it's basically just like 45 minutes of fluff and stories. And there's 15 minutes of gold. So essentially, and, you know, a number of other things happen in that time. I go out to LA and I realize, oh, there's a thriving practitioner community meetup in LA and there's nothing like that in New York. So me and my partner at that point, and literally at this point, Steve, I've done 100 practitioner events, tiny events. You know, we've done so many little events. I've come to all kinds of learnings, things like, if you have an event and you hire a speaker, like if I hired you to be a speaker for one of my events, if you're good, it makes my event look good. But if you're bad, it makes my event look bad. Sure. So I worked out, you know, because I didn't really know whether people would be a great speaker or not. Some people, you know, you think they're going to be good, or they're not good. So we started out this format where we'd have 3 speakers doing 15 minutes each rather than, you know, 1 speaker. And I realized, like, I did that a couple times and someone was bad, but the other 2 was good and the whole event was good. And I was there like hosting and whatever. And that became the Functional Forum. So the Functional Forum. So
that's almost like you modeled that over after like a kind of like a TEDx model.
Yeah, well, I saw TED was really kicking off at that time. And I realized, like, shorter talks are better, attention spans going down.
Yeah.
And, you know, and also I realized, like, look, all of the organizations in healthcare that were doing things, like all the big conferences, were stuck in the CME model, which is by its nature extremely boring, right? So,
for sure.
and people told me when I came up with the idea for the Functional Forum, they're like, if you don't have CME, it'll never fly. That's the only reason why you can get these doctors' attention. And I was like, I know that that's not true, because I can't give a CME talk. And I've had doctors laughing and enjoying themselves and whatever at this conference. So I'm going to try and make something that doctors want to watch, right? They want to engage with, rather than they're forced to for their CME approval. And people said, like, it'll never work. So we get the Functional Forum and we do it in New York. So it starts off as the meetup group for doctors in New York. And the first one we do, you know, I use all the efforts that I can to fill it. I've been hustling and making relationships. And I have the first show, and, you know, it was a knockout. And the reason why it was a knockout is because I just happened to know Kelly Brogan. She was one of my customers. No one knew who she was. We did the first show. I put her there as the first speaker, and she was dynamite. And everyone was just like, they couldn't really work out what had just happened. But, like, I had hosted a show. We had videoed it. I had her. I had my partner Gabe do a talk on essentially like behavior change. And then Dr. Donnie Wilson, she was the doctor of Mark Bertolini, who was at that point, the CEO of Aetna. And so we made the show, and it was just a hit from day one. Like, everyone loved it. It was full. The second one was full again. I had Larry Pilevsky, and then it just had this momentum. And it was just the right thing at the right time. Like, at that point, live streaming was hard, but in the 4th episode, where the live stream actually worked properly, because live streaming wasn't as easy as it is today, I convinced Mark Hyman to come and speak, because I had this event, and it was the whole series of events on how I got Mark Hyman is like an amazing story in itself. But, you know, on the 4th ever episode, we got the streaming right, and he came and spoke. And at that event, he announced, he had just flown in from Cleveland that day, and he announced the Cleveland Clinic Center for Functional Medicine on my show.
I remember that. Yeah.
And so then it was just like, I think, you know, that video got passed around, and it was on our YouTube channel. And then suddenly, like, our thing was hot. And, you know, I had been following, like, Tom O'Brien had done the Gluten Summit the year before. After the first episode of the Functional Forum, when it first went down, the tagline for the Functional Forum was accelerating the evolution of medicine. And essentially, we had decided that we wanted to have, like, some clinical, but have some practice management and some technology as well, because that was going to be our brand, because no one else was doing that. And, like, the technology was a focus. And the reason why we came to that conclusion was also an interesting story. But ultimately, we just, after the very first functional forum, I called the guys who did Tom O'Brien's summit and I said, I want to do an evolution of medicine summit. And we agreed next September. And basically from then on, it was just sort of this juggernaut. By October 2014, so, by later that year, we had 30,000 doctors watch the October 2014 event. And then it was already kind of game over because everyone else, there's 1,000 doctors going to the IFM annual conference, right? So to have that much attention and to have that many email addresses of that many doctors put us just in a radically different position.
Yeah. Yes.
And everyone wanted to speak on the show. Everyone wanted to meet me. IFM wanted to make a partnership. All of that stuff, started to happen. And then 2015, it carried on growing and we did the same kind of thing. We did the functional forum. We've done a functional forum every month for 9 years now. Right. So, in that way. And then the book, which is the first time you came around, that was really, I guess that was the moment when we sort of realized at the beginning of 2016, like, what can we really get our hands around to make an impact with? Like, it's one thing to just make content, but still I would meet so many doctors who were like, they love functional medicine and they're doing it on their family, but they've got a day job being a doctor and they can't like get out. Yeah. And, what we tried to offer them throughout the functional forum and then, through the book was sort of a vision that like, hey, all of these other doctors have left conventional care, practice on their own terms, do functional medicine, love their job. And this is an opportunity. You could do this too. And that's essentially, that was essentially the brand. But that came from doing all these functional forums because I would interview all these great people and hear that people had done it. And, so it was almost like 5 years of that point of in the making of that part that came up to the book. But, as I said, it all happened one step at a time, but it sort of really caught light when the functional forum took off in 2014.
Yeah, I have just a short anecdote and then a couple of questions. You mentioned Dr. Saxena. When I lived and practiced in North Tampa, I actually lived about a quarter mile down from her office, but, she and I never had any opportunity to meet back then. In your early years, when all of this stuff was gearing up, did you get any friction from people who were kind of looking at you sideways going like, this guy's a sales rep for kind of like a fringe supplement company that really only serves a minority within the larger scope of functional medicine? Or was that easily overcome with your history of running a successful practice and your background in investment banking?
So a couple of things. So one is, as soon as the functional forum took off, I quit that job.
Yeah.
So like I realized in 2013 that I couldn't do what I wanted to do in the world as a rep of a supplement company. And it was good to learn and it was good, it gave me the money to do it. But like, and also I realized like, we came very close to it being the Metagenics functional forum. Like we tried to sell Metagenics on giving us 20 grand a month to do the functional forum, and they should have done it and they didn't do it.
Yeah.
And I'm so glad they didn't, because we realized like there's so much like tribalism, I guess, in functional medicine with supplements. We made a decision early on that we were going to be supplement neutral and not have any supplement like that. And that was really good. So, everyone who was coming across me for the first time, they didn't know that I was a supplement rep. I didn't really talk about it. I talked about myself as a practice management leader, and I had practice management content on each forum. So it was more of like a shift in positioning. So, I haven't really spoken about the bioenergetic stuff again for a long time. And it started to come back round again because now you have this whole, cohort of medical doctors that have got trained in functional medicine. And when they look into like the niches of like chronic